Hello, my name is Dr. Syncia Sabain, and I work at Unique Rehabilitation and Health Center. I'm working with the DC Department of Health to help raise awareness of the issue of bacteriuria. This is when bacteria are present in a urine culture in someone who has no symptoms of urinary tract infection. This is a very common condition and occurs in up to 50% of elderly women and 35% of elderly men who reside in long-term care facilities. Studies demonstrated that antibiotics do not benefit these residents and are at risk for developing antibiotic resistance bacteria, which may be more difficult to treat in the future. The first step to avoid prescribing antibiotics for bacteriuria is knowing when to order a urine culture. With rare exceptions, such as during pregnancy, providers should only order urine cultures in residents who have symptoms of a urinary tract infection. Changes in urine color or odor in an asymptomatic patient should not prompt a urine culture. In the event an asymptomatic resident does have a urine culture sent, providers should interpret those results carefully. Unfortunately, the presence of white blood cells or pyuria doesn't necessarily mean an infection is present, as many asymptomatic residents with bacteriuria will have white blood cells in their urine. Remember to look at the resident. If the resident has no symptoms of an infection, then we can't make them better with antibiotics, but we can make things worse by selecting for antibiotic resistance bacteria, which could then be spread to other residents. Each time a resident is exposed to an antibacteria, there is a risk for the development of antibiotic resistance. So remember to order urine cultures only when necessary and to prescribe antibiotics carefully. Work with staff to encourage perinatal care for both women and men and ensure the residents are wiped and rinsed properly after care is provided are all things that can be done to reduce infections amongst elderly populations.